My name is Melissa Chiang, and I'm a dermatologist. Yes, I think emotions are very important in my profession. And the reason why is because I have emotions and I'm interacting with other people who also have emotions. And there's two groups of people generally that I interact with. One are the people on my team. So those are the people that I work with day in and day out, and we're like very familiar with each other and each other's emotions. And then I also work with patients, and the patients are people that I see not as frequently and I don't know them quite as well. So that takes a little bit more perception in terms of trying to read their emotions. The top three emotions. Okay, I think that probably number one is gratitude. That's an underlying emotion that I feel all the time because I feel very grateful to be able to do the job that I do, to be able to make connections with my employees, but also with my patients. And oftentimes I get to connect with people on a level that I think is really deep, and I think it is because of that physician-patient relationship that we have. So that's the first emotion, gratitude. The second emotion is probably engaged, because I am really motivated to do well with my work and I'm interested in my work, so I'm always trying to get better at what I'm doing. So gratitude, engaged. And then my third emotion is sometimes work is hard, and so sometimes I do get frustrated. Sometimes that frustration is with myself. Sometimes the frustration is with circumstances around me. In my profession, and maybe this speaks more so for me in particular, I really depend on reframing to help with my emotional regulation. I would say reframing, and then also, well, yeah, it all fits into reframing. So sometimes I think I get frustrated with myself because I'm not performing as well as I would want to, and that takes place when I'm learning something new. I want to be perfect at it from the start, but it oftentimes will take me several attempts, and so the way that I try to deal with that is to prepare myself. But then secondly, when I'm looking back, I try to reframe, if I'm frustrated with my performance, that I'm on a step towards learning how to do it better. And then the other reframing is trying to think about it in time. So if I'm frustrated with myself in these 5 minutes, what am I going to feel like in 5 days, 5 months, or 5 years? And that usually helps to take care of emotions that are at a high level, to like bring them down a few notches.